There has been an extensive research into long COVID now. More than $1.3 billion of research is happening in the US, and the UK itself, as of June 2022, has put in more than £30 million of research exploring various treatments and biological mechanisms for why long COVID happens in some people. And at this point of time, there are four big likely causes for long COVID. The first is to understand really what is happening in this condition. What does the virus do in some people? And what is most likely to be happening is that there is a hyperactivation of the immune system. The virus naturally excites and alerts the immune system, and in some people this immune system hyper alert state does not go back to normal, and that is a big problem in most patients. Within the immune system, one kind of cells called the mast cells, which are responsible for releasing histamine, they are the ones looking like they have been most affected. So that is the immune system activation. When your immune system is that hyperactive, it is almost natural for the nervous system then to be hypersensitive. And nervous system hypersensitivity is then responsible for a lot of the aches and pains that happen in many joints. And more importantly, we are now starting to realize that one part of the nervous system, the autonomic nervous system, which controls your digestion, your heart rate, your breathing control, then that can have profound effects on your cardiac symptoms, on your respiratory system, and on your tummy. So that can be the nervous system and the immune system. There is now research emerging that a third cause, or probably a related set of causes, is going to be the effect on the circulatory system in terms of what is called microclots, because of the tendency for these clots to form in certain organs in small blood vessels, and that can be a third cause. Now, one might think actually, well, what is actually happening? Is it that each of these systems are being excited because they're being exposed to the virus or a fragment of the virus? And that is likely to be a fourth cause, where people are thinking that there may be just some residual viral fragments that is present either in the tummy or sometimes in that region of the nose, and these might be responsible for reactivating the immune system ever so often. So these are the likely four causes for long COVID at this time. We have to probably take into account one possibility, that we are seeing many patients where all of these symptoms of long COVID are actually happening after they've had a vaccine. So, they may not have had any active viral illness or COVID at all, but all of these are being started off after they've had their first or second dose or the booster dose of the vaccine. So we have to realize that even vaccines can also hyperactivate the immune system and can cause the same cascade of symptoms that are seen in long COVID due to a viral infection as well. Hi, I hope you enjoyed that video. If you want to hear and see more, then please click the subscribe button and hit the notifications button so that you'll know when the next video is released.